The other issue is there's not as much agreement on, and that is whether that short-term budget should spend any money on Obamacare. And that one's become more conflicted. And my perception of it is twofold. One is, you know, I oppose Obamacare for the same reasons you do, because I don't believe government should be in the business of taking over 1/6 of our economy. But now I oppose it for additional reasons. And that is that during this month that I've been in Florida, I've traveled around and met with small businesses, and they're all saying the exact same thing. And I'm not talking about Republican small businesses. I'm not talking about conservative small businesses. I'm talking about everybody, including people that 6 months ago were holding a sign to re-elect Barack Obama. Here's what they're telling me. That this thing is so uncertain for them that they are moving workers to part-time. They are cutting people's hours. They are rolling back on pay. What they're definitely not doing is expanding. I have met multiple businesses that have told me, I'm not going to open an additional facility, or I'm not going to hire more people. I'm not going to expand because I don't know what this means to me. The other thing I'm hearing more and more of is people who had insurance coverage are losing that coverage. And what that means is that you have a doctor you've been going to for 15 years, and now that doctor's not on your plan, you can't go back to that doctor. And so they're losing their existing coverage. And the last thing I'm hearing is these exchanges are going to be a disaster, these healthcare exchanges that they're setting up. Because in many states, all 17 states that are doing them on their own are all behind schedule. There's a handful of states that have only had 1 or 2 companies apply. And what that means is there's not going to be any competition. So the premiums are going to go high, and then if they can't get 7 million young healthy adults to sign up for it, the premiums are going to go through the roof. And the problem with that, and the problem with them getting 7 million young adults to sign up, is these young adults are going to have a pretty simple choice. They can pay about $95 a year to the IRS as a fine, or they can pay $200 or $300 a month for health insurance. And I think they're going to pick the 95 bucks. And that's when these exchanges are going to collapse. So anyway, because of all this, my point is this thing's a disaster. The president's admitted basically it's a disaster by delaying, in my opinion, unconstitutionally elements of the law, because he can't just sit there and decide I'm going to enforce this, but I'm not going to do that. And then, so why would we spend a penny more on something that's such a disaster? By the way, I'm sure you know this by now, the Teamsters Union is now riled up against this. The union that represents the IRS workers now wants to delay Obamacare. So all my point is, I'm not voting for any short-term budget that breaks the spending caps, or short-term budget that spends a single penny on Obamacare. Now that